This episode brought to you by the Neurodiversity University, a new division of the Neurodiversity Alliance, home of the Neurodiversity Podcast. Check out Strategies for Supporting Twice Exceptional Students, a continuing education and professional development course for educators and school districts from Emily Kircher-Morris, author of Teaching Twice Exceptional Learners in Today's Classroom. For details, go to neurodiversity.university.
What is neurodiversity?
What is it about these people?
Dyslexia,
autism spectrum,
ADHD, gifted,
dysgraphia.
All brains are different.
It's okay to be who you are.
This is the Neurodiversity Podcast.
Hey there, I'm Emily Kircher-Morris, and welcome to episode 108. This week, we're doing a Best of 2021 series, and the second episode we're highlighting features the author of A Parent's Guide to Oppositional Defiant Disorder, Your Questions Answered. And she shares her conceptualization of this controversial diagnosis and how we can support kids who may show these behaviors. We are super excited to be preparing to launch the Neurodiversity University in the new year. This hub will be a place for educators, parents, and professionals to find virtual learning opportunities that can help them understand and support neurodivergent people. Our first course is geared toward educators who support neurodivergent gifted kids, also known as twice exceptional kids, and includes 6 different modules about how to understand, educate, and accommodate these kids' unique needs. If you think this course might be interesting to you or your school district, be sure to go to neurodiversity.university and check it out. That's neurodiversity.university with university as the extension instead of .com. Okay, today we're taking on a bit of a controversial diagnosis, Oppositional Defiant Disorder, with someone who can definitely shed some light.
Hi, I'm Amelia Bowler, and I'm the author of The Parent's Guide to Oppositional Defiant Disorder, Your Questions Answered.
Don't go anywhere.
Identifying, supporting, and challenging gifted and twice exceptional students is often difficult for school districts. But Emily Kircher-Morris's new book, Teaching Twice Exceptional Learners in Today's Classroom, provides guidelines and a unique approach for identifying and understanding 2E students. It includes strategies that will help educators and administrators provide strength-based instruction, motivate twice exceptional learners, and even help them with self-regulation. It contains important information to help educators advocate for 2E students, including things you need to know about individualized education plans and the Section 504 plan process. This important new book is now available. Go to neurodiversitypodcast.com for links to get your copy. Teaching Twice Exceptional Learners in Today's Classroom from Free Spirit Publishing.
Today, we are talking to Amelia Bowler, author of A Parent's Guide to Oppositional Defiant Disorder. Amelia, thank you so much for taking the time to join us today.
I was so excited to talk to you.
I have to confess that we have not done an episode on the topic of oppositional defiant disorder, really because I have some really negative feelings about the diagnosis. I feel like a lot of times when it is given, it doesn't really provide a lot of answers, and there is this really negative connotation just in the name itself. So I'm open to learning and hearing, and I feel confident that you're the person to give us a different perspective. So can you start us off just by telling a little bit about your experiences with ODD?
Unofficially, my experiences with ODD probably started in my own childhood, where I'm wearing deliberately odd socks. But officially, when it came up for me, is when I had my first child. And as we were going through the diagnosis process for ADHD, which is part of my neuroprofile as well, I noticed that he met all the criteria for ODD. And they said, no, we don't want to diagnose him with ODD, but he does meet the criteria. And this was concerning, like, okay, does my son have some kind of biological difference that I don't understand? Is there some kind of condition that I've caused with my parenting? So I started to really deep dive. And honestly, the more I read, the more confused I got, which is sort of how we ended up with this book, because I just didn't stop.
You kind of start doing the research and you dive into it, and it just brings up more and more information, and realizing that there wasn't a lot of good information out there, which I agree with. I think that that's something that I have found as well when I work with my clients and families who either come in with this diagnosis or have questions about it?
I think as I researched, I started to notice, I think the best I can do is explain why it's such a terrible diagnosis.
Sure.
It's a behavioral diagnosis. It describes a pattern. It tells us what you're seeing, and it's largely framed from the adult's point of view. Because if the adult is not standing there giving instructions, there's nobody to oppose and there's no one to defy. So it starts with the power dynamic, and that's contextual. It doesn't take into account the individual's needs, motivations, desires, abilities.
Mm-hmm.
So there's a problem. If you want to ask the question, why is this child not complying? There are lots of possible answers. But the other confounding factor is when you look at the diagnostic criteria, there are very, very different descriptions within the overall profile, and you don't have to meet every criteria. So just to give you an idea, there's sort of three groups. One of them describes a lot of emotional ups and downs and outbursts and crying. Another group of so-called symptoms describes a determination and a forcefulness to the way this child is interacting with adults. And then a third category describes a sort of, well, they call it vindictiveness. They are dishing it out as they're getting it. And, that doesn't go over very well with adults. So on that list of 8, you only need 4.
Mm-hmm.
So you could have so many different children with different struggles. One of them is very motivated and not picking up on other cues. Another is very sensitive and is telling you, this is a problem for me. And another one is very angry and hurt. So when you look at the research, these children are all thrown into the same pool. And then we're trying to draw conclusions about them. And they're very, very different profiles, in my opinion.
Maybe to backtrack just a little bit, for those in our audience who may have heard that term oppositional defiant disorder or ODD, but they really don't know what it means, you kind of described those 3 different categories, but can you even describe a little bit more in detail what the diagnosis describes?
So when a child is given a diagnosis of oppositional defiant disorder, it's a psychiatric diagnosis. So here in North America, it comes from the DSM-5, which is sort of manual for describing different so-called disorders. So as a society, we decide what is normal behavior and what is pathological behavior. And we've decided that arguing with adults is pathological behavior. So basically, if the clinician decides that this child is arguing or defying or provoking more than other children based on a lot of relative terms like culture, gender, socioeconomic status, and it is a very, very relative and subjective judgment, then you get the label and you're given a disruptive behavioral disorder.
It's interesting as you're describing this and talking about that subjective piece about a child who argues more than what we should expect. To me, it's such a dynamic piece of a relationship. There are some people who I find myself butting heads with. There are other people who I get along with very well. And I know that partially is me, but I think that's also partially the other person's personality as well. And so when you translate it to this, I can just see how, it's kind of a moving bar.
Right. So in the context of a relationship, you're absolutely right. What one person is bringing is really important, and that's nowhere in the diagnostic criteria. What we also haven't really looked at is our cultural practices, because we really normalized a lot of coercion in schools and in families.
Mm-hmm.
And if you're not trying to coerce somebody, it's really hard to be oppositional and defiant.
Right. Like I mentioned at the beginning of our conversation, I'm really resistant to the negative image that ODD brings up. And one of our missions at the podcast here is to really try to understand neurodivergent people through a neurodiversity affirming lens. So related to some of the language that we use and our understanding of the diagnosis, how would you suggest that we could make it more accessible to people?
Well, when I talk to parents, I definitely try to approach the situation from a strength-based point of view, because there are so many positive things that we can see, even in the middle of this interaction, like these kids are brave. These kids are determined.
Mm-hmm.
These kids are expressive, and they are often very, very resourceful.
Mm-hmm.
it's easy to be uncomfortable when you're being outmaneuvered, when things aren't going your way as a parent or as a teacher. But if we really try to appreciate the individual to be honest, before we get emotional about not getting our own way, that I think is a really good starting point.
Mm-hmm.
There may be differences neurodevelopmentally in some of these kids that we also have to be sensitive to. So really, you know what my mission is? It's not to make kids more compliant, it's to make parents more understanding and to understand where these little people are coming from.
Mm-hmm.
Because so many different factors can play into it. I was talking to a parent yesterday who asked me, does my child have oppositional defiant disorder? He does the opposite of what everybody asks him to do in a very literal and consistent way. And I was able to share with her, well, there's no biological reason why yes is no and no is yes. But when you tell me about this child's learning history, he's not enjoying it when people say good job. He's fed up with people giving him orders all the time. And he's enjoying the connection and the engagement that he's getting when he's smiling and doing the wrong thing. This is a kid with a great sense of humor, and he's really, really trying to engage with you. And it's not malicious, and it's not deviant. It's just a product of his skills and this environment fit together.
Mm-hmm.
There will be cases where when an adult makes a request, it seems totally reasonable to the adult. So part of my work is really to look into how neurodiversity plays into that, how we can understand different perspectives. So for example, if executive functioning skills are coming into play, maybe this child has already made a plan and you have come along and you've imposed a different plan. And so the process of shifting attention from one plan to another, problem solving, like that may be a heavy load for this kid to carry right now.
Mm-hmm.
You may also have a child who's very sensitive to stress. And so when you put pressure on those executive functioning skills, you see an increase in stress. So those two pieces came up over and over again in my research. I mean, you can really boil it down to a very physiological level. You have differences in skin conductivity, you have difference in cortisol levels. And the more we try to control and push, the less room there is for self-regulation and for problem solving.
I like that you mentioned problem solving. Can you talk a little bit more about that and how that might influence a child's reaction to situations?
Yes, I think it's underrated, but it's probably becoming a more mainstream approach. More often than not, in a conversation with parents of, spirited children, Dr. Ross Greene's book, The Explosive Child, will come up. And so he's laid out very simply and clearly some steps that the adult can model to help children learn how to problem solve. But the onus is really on the adult to set the stage there. The reason why it's so important to do that systematically, empathetically, calmly, is because problem solving is a very complex skill. It requires perspective taking. It requires logic. It requires, emotional self-regulation. And sometimes we can't ask for all those pieces at the same time. We have to ask for them one at a time.
In my experience, oppositional defiant disorder is often a diagnosis that we see along with something like an attention deficit or autism diagnosis. What are some of the common diagnoses that might co-occur with oppositional defiant disorder? Are there others? Are those the two main ones? What's your experience there?
Well, the ADHD does overlap. There's a 50% overlap both ways. If you're diagnosed with oppositional defiant disorder, there's a 50% chance that you have an ADHD diagnosis. And that's really interesting because we know ADHD is associated with difficulties with executive functioning skills. Some researchers have looked at the students who appear to have, very competent executive functioning skills, but they're still getting into these escalated situations. And what they realized in this research is that their executive functioning skills, like when they're tested after they've been upset, in one of those little psychological tests where you make the child feel emotionally rejected,
Mm-hmm.
then you ask them, sorry, I'm giggling, but it's awful. So these kids, when you test them on a good day, they seem fine. But if you put them in a situation where nobody's passing them the ball or somebody appears to be cheating, and then you test them again, what you see is that their ability to problem solve has been compromised. They're not coming back to baseline as quickly as the other kids. This is really interesting in relation to the comorbidities and the other conditions that you mentioned, because there are conditions and situations or certain emotional and physical profiles that contribute to getting a diagnosis of ODD, but is a correlation or causation. Down the line, a lot of children diagnosed with oppositional defiant disorder are also diagnosed with anxiety disorders and depressive disorders. And I think it's a fair question. Are these children just so used to being rejected, controlled, criticized that there's a lot of damage happening to their, self-concept, and they're not getting the coping skills that they need with the interventions that they're being offered?
Yeah.
A small percentage, about 30% of kids diagnosed with ODD may be diagnosed with conduct disorder later. Again, conduct disorder is a behavioral disorder, and it's not associated with a very specific psychological or emotional profile. And again, very subjective. But what we see with conduct disorder is that instead of the sort of so-called antisocial behavior that happens in relationships, the rule breaking has started to generalize to other situations. So if it's escalated to the point where you've actually broken a law, then we're going to call it conduct disorder. But conduct disorder encompasses, things like setting fires and stealing, whereas oppositional defiant disorder is very much about the two people in the situation. So you got to wonder, at some point, do these kids just check out and, just make their own decisions about what's appropriate? It makes me wonder where the approval is coming from in these situations. Like, behavior usually makes sense on some level. So how did it get to the point where setting a fire seems like a really good idea?
I'm reminded of a family that I was working with, and their child was really struggling at school with some behaviors and also in other situations at home. I think mom had kind of come up with some good ways to support the child. And so that was where the least of the problems occurred.
Mm-hmm.
But as I was working with them, this kiddo clearly was very, very bright.
Mm-hmm.
But a lot of the concerns in my observations were coming from difficulties with social language and social communication, as well as some very black and white or inflexible thinking related to this is what I was expecting and now this is what's happening. And so my thought was that he's autistic and has that pathological or pervasive demand avoidance profile. And when we went to the school and we were really trying to access some special education services, because clearly this family needed some support, there were some major concerns, safety-wise and otherwise. They wanted to go through and assess, and they kept wanting to lean towards, well, we have to make sure that it's not, if it's oppositional defiant disorder, then they didn't want to provide services for that. And so it was this whole back and forth. I think there's a lot of overlap and confusion there. And I think sometimes kids are misdiagnosed. And then also, how do you get a school to support the kids that have some of those confusing characteristics?
I do think that the term oppositional defiant disorder can sometimes give adults license to be offended. Whereas if it's a developmental issue, then they'll choose not to be offended by the behavior. Oppositional defiant disorder is very good at describing what the adult is experiencing. It does not tell you anything about the challenges that the child is going through. And unfortunately, the fact that we have it listed in the DSM makes it sound like this is a specific fault or difference in the child that must be corrected. It's much more likely that the pattern of behavior that fits what we're calling oppositional defiant disorder is related to a struggle. Now, it's important to ask the question, if you have a class full of children and they're all responding to the same cues, except this one individual who's responding to it a little bit differently, what's different about the child? It's really silly to say, well, the child doesn't like following directions. That's ridiculous. If you said, eat a chocolate cake, they would probably eat a chocolate cake. But are they having trouble switching their attention from one thing to another? Are they having trouble ignoring irrelevant stimuli? So they're focusing on information that's not really helping them, or they're having trouble focusing on the thing that the adult would like them to focus on. It could also be that there's conflicts happening, again, because when the social information isn't flowing back and forth the way it's expected in the group, there's going to be conflict. So yes, with a child who's not able to negotiate for what they want, who's having trouble tamping down some of those impulses, it's nothing to do with whether the child wants to follow your instructions or not. There's just these interfering factors. And very often you do get stuck at this point. This becomes kind of a dead end with schools because they'll say, well, we have to get a psychological assessment, and there's an 8-month wait for that. Or you can do it privately, but it costs $2,000. And if we don't have the paperwork that says there's these other psychological problems, we're going to call it a behavioral disorder. That's a very typical sticking point. What would I say? Well, I'm writing a book that's coming out in April for teachers.
Oh, wonderful.
That might be a start.
Yes.
But I think I would really just try to focus on the individual and not the label.
Can you talk a little bit specifically about pervasive demand avoidance or pathological demand avoidance versus oppositional defiant disorder? Like, are there any ways that you could see specifically that those would be somehow teased out? Or is it just harder to do that than a quick answer on a podcast?
I wish I could tell you more. I think that one of your previous podcast guests, so I think you're one of the best resources right now. Part of that problem is it's not in the DSM, meaning it's not being diagnosed officially by clinicians, then it's very hard for researchers to find large groups of children to test and analyze and look for those commonalities. It seems to be more commonly diagnosed in the UK right now, but in North America, this is not a very well-known profile.
Right.
So like ODD is treated like, oh, this is a normal medical thing that we all understand. Demand avoidance is a little bit more something that parents find out about on their own and they don't end up talking about with their doctor.
You're right. I mean, I think so many autistic kids who fall under that profile, I think, first of all, a lot of those kids are kids who are often missed for an autism diagnosis just in general, a lot of times, and so that's kind of if you can't even get to that point, how do you get to the second point there on the pathway?
Yes. If it's not something that we're looking for, if we're not even looking at the individual and we're just looking at how is this child fitting into the context in the way that's expected, then we're really focusing on the needs of the adults in the situation and not the needs of the child.
Okay, let's talk about some ideas for parents. What are some of the things that you feel like can best serve parents or adults so they might be able to support kids who struggle with either oppositional or defiant behavior?
Well, in my experience, I think the very first lesson that I learned was about my own emotional self-regulation. I have a clinical background. I was trained to keep a straight face and to keep my tone even when I'm speaking to children, but I don't think that I was ever trained to really process my physical reactions, to regulate more thoroughly. So what I was doing was I was just keeping an iron grip on my emotions, and then I would end up so tense that I wasn't really focusing on my child anymore. I was just focusing on biting my knuckles and not exploding. So the first thing that I write about in my book is really acknowledging to parents, this is really hard. This is a process for you. You've got your own emotional ups and downs. And what it takes is a lot of self-compassion and a community of people that will help you unpack some of the triggers that are coming up for you. If you understand your triggers, then you're not taking things as personally. There's a lot of self-talk that goes on that maybe we don't even realize as parents, like, you're terrible at this, your child hates you, you're failing. And when we're tuned into that, we're not tuned into our kids. So that's job one. I did mention the strength-based approach. Once your attention is on your child, if you can notice, the positives and appreciate those, that also helps. That goes a long way. But strategy-wise, yes, I could talk for hours about that because I've learned a lot from so many different kids, including my own. One of my favorite approaches, somebody actually wrote a book about it. It's called the Declarative Language Handbook. And I would recommend every teacher and parent picks this up. It's something that I was actually doing, but I didn't know what it was called. It's a way of speaking that gives information without placing a demand. Because traditional behavioral training, you know that once you place a demand, you have to follow through. Not actually true. But if you want to avoid that, though, if you want to avoid having to decide, oh, okay, they've just said no, now where are we? You can present the situation in a way that's a little bit less directive. We're not using the imperative tense. So, for example, I spoke to a mom recently, and she said, when I say it's time to start getting ready for school, go to your room and change, she gets very upset. So I dug a little bit further. Like, is there something that she doesn't like about going to her room? Is there something she doesn't like about getting dressed? No, all those things are fine. She'll happily do it. It's just when I tell her to, she doesn't want to. So what we did was we worked on ways of giving her the information that she needed without placing the demand. So, oh, I see it's 8:00. Pause. I think sometimes as parents, we have so many things going on and we want it done. We're going to cross it off the list. And so we tell everybody exactly what they could do to do it really well. Sometimes that gives us the opposite of what we actually want. So my favorite strategy, just as a general approach, it seems to work in a lot of situations, is try to give information from a factual point of view and see what the child is able to do with it. How do they react to the fact that it's 8:00? They may give you some information that's useful before you lock yourself into a yes, no discussion.
I think you're right. It's a thing that a lot of parents perhaps do, but maybe don't realize even how to maximize the usefulness of using that declarative language.
In the classroom, teachers are also really, really trained to give effective commands. And there are absolutely situations where you want the instructions to be crystal clear. Like if you're training to be a surgeon, I don't want to infer where the cut should be. I just want you to tell me. But I do not need GPS instructions to get to my desk. So when a teacher communicates using words from his or her perspective or their perspective, like if we finish before 11, we will have extra time. It's an observation. It's just something to think about. Because what we're trying to help children do is fill in more of the blanks. They're not interested in hearing a list of instructions all day. They're tuning you out. So if you give them information in that format, if we think of this information as something we're offering the children, maybe they're accepting it with more willingness, because it really comes down to trust. Something that came up as I was researching the book for teachers is what does it mean to trust? What does it mean to have rapport? If you have a traditional behavioral background or even an educational background, it just means be nice, associate yourself with good things, and really trust is much deeper than that. It fundamentally means we share the same interests and we're both playing for a win-win situation. If I set it up so that in order for me to win, you must lose, then the opposite is true. For you to win, I must lose, and we're really stuck.
Right. So last question as we wrap up. If you're talking to a child who has begun to believe many negative things about themselves because they're constantly feeling angry or being reprimanded or getting in trouble because they are struggling with behaviors that others describe as oppositional and defiant, what would you say to that child?
Well, last night I said to my son, "You are," and then I paused and he said, "Amazing." Said, yeah, that's exactly the word. But I was so glad. I was so glad that he knew that. The reason why he knows that is because he gets to spend time with people who have his best interests at heart. And he gets to spend time where he feels safe. If he's not feeling safe, then he's working to defend himself and to prove himself, and he's working against other people. So I'm glad that you're bringing things like emotional well-being to the forefront, because we really can't expect compliance and rule following if we don't have an emotional grounding. So the best I think we can do for our kids is to reflect their strengths, to practice compassion toward ourselves so they can see what that looks like. We don't beat ourselves up in front of our kids because they'll learn to beat themselves up. We accept our mistakes. We accept them as learning experiences. and we have to let other people's judgments go. And that's like a lifelong process. But, kids diagnosed with ODD often are faced with so much negative feedback and description and accusations and blame that I think as parents and supporters, we have to work so much harder to build those skills in sooner.
Amelia, thank you so much for your time today.
Oh, it was a delight. Thank you so much.
Behavior is an outward manifestation of something that is going on internally. Behavior is something that we adults can see, and we often either don't take time to understand what's behind it, or we assume we already know what's causing the behavior. Let's take a step back to objectively observe what a child is doing or saying, and have a neutral conversation with them to help them discover what's happening beneath the surface of that outward emotion. Oppositional or defiant behavior is often code for, I feel like I have no control, or I'm anxious about failing. When we remove our own emotions from a situation, we can focus on finding solutions that make our relationships with our kids more stable and secure. I'm Emily Kircher-Morris. I'll see you next time on the Neurodiversity Podcast.
As 2021 comes to an end, we'd like to thank you for making it a year of incredible growth for us. Please continue to tell others. Thanks to the musicians who contribute to our podcast, without whom we'd just be a voice with no background music. As we move into 2022, we do so with optimism that it will be a better year for all of us. We could certainly use the change. The host of our podcast is Emily Kircher-Morris. The post-production editor and executive producer is me, Dave Morris. And for all of us here, thanks and Happy New Year. This is a production of Morris Creative Services.